Good evening and welcome to my YouTube channel, Pain Free Partha. Follow it up, subscribe, and continue to follow. Today's topic is about use and misuse of t-test. So the T distribution, also known as student T distribution. Now it gets its name from this fellow Gossett. And who first published it in Biometrica Journal. This is pseudonym student. Because his employer, where he was employing, his employer doesn't want to use the original names, only the pseudonyms. If you want to publish something, you have to use your pseudonym. So this Gossett fellow, what he did was, he used the pseudonym student to publish in Biometrica about a test, that statistical test. So that is why it is called something, this is a famous Tamil writer called Rangarajan, but is usually called as Sujata as a pseudonym. Now, T value is what statistician refers to a test statistics. That is why it is called T. Now we know why it is called student and why it is called a T, because it is a test statistic. What is it actually? A t-test is a statistical test. It's a statistical test. What is it used for? It is used to compare the means of two groups. Mean of two groups. Whether your treatment or whether your investigations or whether your surgery has done the effect of population of interest. This group is different from that group in terms of means and standard deviation. This is what is called used as t-test. Means of other groups and only two groups. Very important is this. If you want to compare more than two groups, you should use ANOVA test, analysis of variance. So if you want to compare the means of two groups, then we can use t-test. The t-test is a parametric test of difference, meaning that it makes the same assumptions about your data as other parametric. You know what is a parametric data? Means is a parametric data. Non-parametric data is ranking, or whether you vomit or not, whether you have nausea or vomiting or not. This is a non-parametric data. Parametric data means the pain score is 4.2 plus or minus 0.6, where compared to 5.6 plus or minus 1. This is a parametric data, and you've got ranking or non-parametric data. So t-test is used for parametric test. And it should have normal distribution. What is this normal Gaussian distribution means? 95% should be within two standard deviations. Now your standard deviation is some 150 or something like that. Then 1150 plus or minus 150. This is the mean plus standard deviation. So 1150, 1850. You can see 95% are within two standard deviation. Then it is normal distribution on both sides. But this is not a normal distribution. There is something called kurtosis, something called skewness, which we will discuss in the next video. Now we see age. Age is 52 point plus or minus 3.6, one group. Another group is 49 plus or minus 3. So this is mean plus standard deviation, two groups. We can do a t-test. Pulse rate, blood pressure, math, pain scores. All these things are mean plus standard deviation. We can use a t-test. Now 30% are male, 70% are female. We cannot do, there is no means, whether vomited or not, no means. 5,000 babies with or without jaundice. But here, all these things will not cover under the cover of t-test. But you see, in jaundiced person, what is the mean bilirubin in this group? In jaundiced babies, what is the mean bilirubin on this group? Then we can do t-test. When to do t-test? The t-test assumes your data are independent or normally distributed, have similar amount of variance within each group being compared. I will talk about this variance. If one value of one sample affect the other value, then the samples are dependent, for example, height and weight. This is the t-test formula. Now we can see what is, I've told already, variance is so much. Variance is so much means the t-test may not be very satisfactory. What is the variance? You see here 25.09 plus or minus 2 is one group. And you've got another group where the mean and standard deviation is 9.68. This is one group and this is another group. So you can see the data is distorted or dispersed. So this measure of dispersion is called standard deviation. How much it is dispersed. So this is 9.68. Then there is some doubt about doing student t-test. How to do a t-test? It is very simple. There are a lot of statistical software as that. Even Excel does that. So we go to Excel and type these things and type a group A and group B and put this function as t-test, and it will show A1, array 1 is A1 to A8, array 2 is B1 to B8, it is two-tailed, and I will tell what is that and all. Then two sample, all these things will come. If you say click OK, then you will get the p-value. This p-value is 0.69, so these two group mean and standard deviation have no difference at all. So it is very easy to do student t-test in Excel itself. Now, what are the types of t-test? Because it will ask, Excel will ask, what is the type like? The SPSS statistics will ask, what is the type like? Now you have one-tailed, directional, one-side movements only, BP after laryngoscopy and intubation. So, for example, now you have 50 patients. The mean blood pressure is 120 systolic. Now you do a laryngoscopy and put the tube, your BP is likely to raise only. It will not go down. So it means all the values of the second sample is going to be higher than the first sample. That means that tail is one side. That is one tail. Now you check another two tail. If you have a heart rate after laryngoscopy in child, sometimes in children, the heart rate may fall. In some children, it may rise. So it is two-tailed. So the change after an intervention can be this side or that side. It means that it is two-tailed. The change can be in one side only, then it means it is one-tailed. Some more example with one sample or two samples. There is a lot of, I am going to tell what I have understood. Now, one sample t-test means a 50 years male, 100 people, what is the weight? 50 years male, 100 people we have selected, and what is the mean weight? We have set standard already. In Pondicherry, the average weight of a 50-year-old male is 65.2. Then we are comparing this. Then this is an one sample t-test. What is two sample? 5 years delta, which is urban and standards. We have got two samples. Now we have a 50 years, 100 people. After non-vegetarian diet for 3 months, weight gain, then you call it as paired t-test. Now you know one sample, another is no two sample, and another is paired t-test. Paired t-test means there is only one sample. Now you do the intervention. The change occurs. You calculate the mean of before and after and compare the means. This is called paired t-test, but it is the same 100 people. Okay. Now the same 100 people, you are giving high non-vegetarian diet of 5,000 calories, and after 3 months you see the weight gain. The same people, how much is the weight gain? The mean difference you calculate and put in the t-test distribution. You will get the value. Now you have got the same 50 years, 100 people, but divided into two groups of 50 each. One group was given fruit diet and another group was given NV diet. So assess weight gain. So now you have two groups, and this, so then it becomes unpaired. So you are comparing the means of that later, NV diet and fruit diet. Again, I will tell you, mostly in non-vegetarian diet, it may be up only, weight gain only. But if you give fruit diet, it may be down also, high also. So there is now, you see here, there is a difference. Trick. If you are doing this only, then you may need to use one-tailed because it is going to be increase only. But if it is going to be two things, then both weight gain or weight loss, then you have to use two-tailed. Now I will go. Now you have a clear idea. What is t-test? Independent samples it should be. Then it should with the normal distribution. It is to be comparing the means and standard deviation. So that is what is about student t-test. Gossett named it student because he used the pseudonym student and it is called test statistics. The test as T. Okay. Now we are using this age, weight, all these things are means and standard deviation. You are using one group and two groups and paired t-test. Same group, paired t-test. You are comparing one weight with the already established standard, then it becomes one sample t-test. Your change is likely to be one side only, then it is one-tailed. Your change is likely to be decrease or increase, then it is to be two-tailed t-test. This is about a simple t-test. Now, if you use misuse of t-test, data do not obey normal distribution. You can see this experimental group age is 21 point and this control group is 25.09 because of paired sample. Now you have a paired sample and use an unpaired t-test. We need to use the paired t-test. For example, now you are using burns injuries and instead of your whatever silver ointment, you are using povidone only and the same patients, povidone iodine and see the healing after 3 weeks. Then you have to use paired sample. Okay. Now you have 50 patients, 25 you are using povidone, 25 you are using silver, then it becomes unpaired sample. You are seeing the level of healing after 3 weeks. Unless you do the correct thing, correct t-test, you are likely to be wrong in result interpretation. Misuse because there are more than 3 levels in independent samples. Now you see, we have 3 groups. One is a placebo. We are not giving any drug. The second is 30 mg of fentanyl. Another is chlorine. Another is 60 mg of chlorine. This is, you are checking the hemodynamics. These are 1, 2, 3. 1, 2, 3. If you use t-test, it's not correct. You have to use ANOVA. There are certain modifications of t-test. We leave it alone. Now you are in diabetes. Sitagliptin 50 milligram you add or 100 milligram you add or you don't add anything. Okay. Sitagliptin 50 milligram or 100 milligram if you think, then you can use t-test. If you use sitagliptin 100, vildagliptin 100 or placebo, then you need to use ANOVA. Misuse of independent t-test because of factorial design data. We cannot use t-test. For example, you have 3 types of patients. One, trauma, arthritis, post-op pain. These are pain patients. Now you are doing morphine or fentanyl. Morphine or fentanyl. Morphine or fentanyl. This is 2 into 3 factorial design. Then we have to use ANOVA with factorial design. We cannot use t-test and compare all these things. You will get wrong results. Now we have post-operative hernia. First week, second week, and third week. What is the theme? With males and females, so many confusions are there. Data on the same check tests at different endpoints are not independent, but this has to be done with paired t-test. First, what is the second or third? Now you have a weighted mean test. What is this weighted mean? For example, we all know that postoperative nausea is more with ENT surgeries. Postoperative nausea is more with gynec surgeries. Postoperative nausea is more with laparoscopic surgeries rather than a breast surgery or a thyroid surgery. This is what we know. Now, if you want to compare in with a drug where we do ENT surgery in one group and laparoscopic surgery in other group, this is going to be a confusion. So we need to use weighted mean. See, for example, influential ENT surgeries, your scores will be different. Non-ENT surgeries where the nausea is less, it is so. A weighted mean test means you are giving a mean which is slightly different because we know that this nausea score is more in ENT surgeries. Further misuse of t-test. If the sample size is small, the one sample should not be used. That is outlier. Outlier means what actually I think is Outside you have 2 standard deviations. If 2 standard deviations outside there are so many samples, then we cannot use this. If a group of subjects receives one treatment and the same subject receives another treatment, this is parity test. This is not 2 samples, that's 1 sample. If the subject receive a treatment, then the results are compared to a known value, then it is called 1 sample test. If you use a 1 sample t-test here and 2 sample t-test here and all, this is confusion. It is very clear. Already I have told it. If you have 3 means, no t-test. Only comparison of means between 2 groups is acceptable for student t-test. If you are using 3 means, then you have to go to ANOVA. What should be the sample size? A popular rule of thumb for a 1 sample t-test is 30. When this is working, it is working. Now I will tell you what is the satisfaction score after an acupuncture. Now we have n is equal to 100, control is going to 100, p-value. Now the baseline you see, satisfaction score is 6.9. In control also 7. So the p-value both are okay. Now we have given the treatment satisfaction score. It becomes 8.2 here. Okay. This becomes 7.9 here. And the difference is 1.3 plus 2.2. So in the treatment group, this is p-value is better. But here the p-value is not good. So we think the treatment group is better if you have the satisfaction score after acupuncture. But it's not true. Why? This is 1 sample t-test. And you see here that this is the mean and this is the standard deviation. Now, if you want to see the difference between this here, the p-value is only 0.17. That is why we should tell that the satisfaction score after acupuncture is not significant, saying this, not this. Now, we know student t-test and coming to the summary. History, Cosset, who found out this t-test, test statistics, that's why it is called T, and he pseudonymed as student in an article published, so it is called student t-test. And uses means independent sample, only 2 samples. Misuses 3 samples, 1 tile, 2 tile. If you confuse, then it is misused. Thank you very much, and follow me at Pain Free Partha in my YouTube channel and my website painfreepartha.com for free downloadable 400 slides in anesthesia. Thank you very much.